Welcome to Orthosmile Orthodontics, led by Dr. Daxter Yeo. Modern-day orthodontics was founded by a prestigious group of dentists in the early 1900s, led by a Dr. Edward H. Engel. Over 100 years ago, Dr. Engel and his colleagues painted a vision of creating beautiful, healthy smiles by gradually moving teeth with exacting precision. Their goal was to help patients enjoy a more fulfilling and enriched life through beautiful, healthy smiles. Today, an orthodontist is a licensed dental specialist that has completed his Bachelor of Dental Science with distinction and continued his training by successfully completing a 3-year orthodontic master's program after working at least 2 years as a dentist. The techniques of moving teeth have dynamically changed over time. Orthodontics has become as much an art form as a science. From the technology utilized to conduct a comprehensive orthodontic evaluation in creating a clinical recommendation to the orthodontic appliances utilized in treatment, each are very sophisticated and exacting. Orthodontic care is not always intended for purely aesthetic reasons. Many people suffer from improper jaw function, which can cause headaches and discomfort or even the deterioration of teeth. Even though a patient may appear to have a normal bite and smile, there may be other issues which are causing or will cause stress or fatigue to the jaw and bite. Dr. Yeo will conduct a painless orthodontic examination, which can typically define these issues and, with the proper treatment, correct the problems or circumvent future orthodontic problems. This is why Dr. Daxter Yeo and the Australian Society of Orthodontists recommend that all children receive an initial orthodontic examination by age 7. The process of orthodontic treatment requires the preliminary evaluation of each patient. Just as each of us are individuals, so is the treatment plan necessary to achieve the intended results. There are many different classifications of orthodontic malocclusions or problems. Orthodontic records is a process of gathering and evaluating the information necessary to prepare a treatment plan. Orthodontic records include a panoramic X-ray to attain a view of the entire upper and lower jaw and to view the teeth, roots, nerve positions, jaw structures, joints, and locate missing or misplaced teeth. This X-ray is used for determining large feature problems. A cephalometric X-ray is also necessary to attain a profile view of the face, which is utilized to determine the growth direction of the face for younger patients, to measure the angulations of the teeth, and to see how the upper and lower jaw relate to the face. After radiographs, an impression is taken to create a mold which will be filled with plaster to create a study model. A bite plate is also taken to create a benchmark for aligning the model to simulate the patient's current tooth and jaw positions. Extraoral and intraoral photos are also necessary to provide a reference of the existing condition of the patient's bite, tooth position, and any other issue that may be a concern to the doctor. Once all of the necessary records have been taken, the doctor will provide the patient with a detailed explanation of the findings and a recommendation for correcting the problem. A visual presentation utilizing a sophisticated consultation program of animations and morphs will demonstrate the comparison of the current orthodontic status in relationship to the targeted results. Once our diagnosis is complete and a treatment plan has been developed, the patient is ready to begin treatment. At that time, we will perform a full consultation. For more complex cases, a second appointment may be required. We will then present all of the clinical and administrative information necessary in order for you to have a thorough understanding of our office procedures and how to work as a team in achieving the perfect smile. For those patients requiring braces with bands, the first step is typically the placement of spacers between the rear molars. This process allows the back teeth to gradually separate, allowing the space necessary for the placement of bands on the molars. A band is a small metal ring with a clasp affixed to the front, which allows the band to be secured to the brackets placed on the other teeth. Next, small metal brackets will be cemented to the teeth. This process requires the proper conditioning of the tooth to assure the proper adhesion of the bracket to the tooth. Once in place, the bonding agent on each bracket is activated with a high-intensity curing light. A thin wire called an arch wire will be placed connecting each of the brackets. Ties and elastics are then placed to secure the appliances in place. There are many treatment options available to you. For example, traditional metal brackets are certainly available, or a more aesthetically pleasing, more discreet, clear ceramic bracket may be desired. Some adult patients may be candidates for clear removable appliances, which are tray-like liners that guide the teeth into position. Patients may also choose invisible braces known as lingual braces. Unlike conventional metal or ceramic braces, which are applied to the front of your teeth, these braces are applied behind your teeth. Colored elastics are fun for kids of all ages. School colors, favorite team colors, or holiday colors are often a hit. Orthodontic treatment requires a series of appointments for adjustments and refinements. This is the artistic aspect of orthodontics. Our front office staff will work with you in scheduling each of your appointments. How long will it take before the braces are removed? Treatment times vary greatly from case to case. Age, bone density, and the severity of the problem are all factors which affect treatment time. Is there anything that you can do to help speed up the process? Definitely. Missed appointments or not complying with treatment instructions can lengthen the time in braces. Adjustment appointments provide us with the opportunity to finesse treatment to achieve the intended results. Periodically replacing arch wires and ties during these appointments allow us to guide tooth movement to exacting positions. Please keep in mind that proper oral hygiene is very important, especially when wearing braces. One of our assistants will show you how to properly brush and floss while in treatment. What about after treatment? The second phase of treatment is just as important as the first phase. Retainers are a necessary part of maintaining the results of our mutual efforts. We will provide you with instructions on how to utilize your retainer, when to wear it, and how to care for your retainer. Dr. Yeo and his staff are thrilled to have you on board and welcome you to the first step in achieving a beautiful and lasting smile.